Hello, I'm Tom Abinanti. I represent the 92nd Assembly District, which encompasses the towns of Greenburgh and Mount Pleasant and all of the communities in those two towns. This is one of a three-part series that we're doing to talk about anaphylaxis and epinephrine. Anaphylaxis is a condition where someone reacts very severely to an allergy, like a bee sting, or maybe they're allergic to nuts or something like that. And epinephrine is this wonder drug that, if applied within a very short period of time, will stop that negative reaction of the person's body. Today I have with me Jon Terry, who's the founder of an organization called Allergy Advocacy Association. And I have Dr. Jessica Stern, who's an allergist and immunologist at the University of Rochester Medical School?
That's right.
Okay, good. Let's start with Jon. Jon, you have an interesting but a sad story as to how you got involved with the Allergy Advocacy Association and the whole field of anaphylaxis and epinephrine and the response to it and whatever.
Yes, that's true.
Can you tell us a little bit about that?
Well, first of all, Tom, I want to thank you for the support you've given us over the years in trying to improve access to epinephrine and training in case of anaphylaxis emergencies. You have been one of the point persons on these bills, and we very much appreciate it. Our association is very grateful.
Oh, thank you.
In terms of how I founded it or why I founded it, it was in tribute to my sister, Ruth T. Cornell. Ruthie was a victim of anaphylaxis after she was stung by a honeybee, and she went into a coma. This was just about 8 or 9 years ago, and the thing that happened with Ruthie that was very unfortunate, she didn't know that she was allergic to bee stings. So she was completely unprepared for it, and even though the paramedics got there very fast, they couldn't really help her. So that's one of the things that we try to do, is we try to train people in how to respond in an emergency, raise awareness, and try and get the public at large to be more careful with foods, with medications, and with insect stings, to make sure that they know what to do and to provide aid if it's needed. And also, if they have one themselves, to take proper care of themselves.
Why were the emergency personnel not able to help your sister?
I think mostly in that situation was because she was too far gone. The anaphylactic attack was very, very severe. And even though the EMTs were there in just a matter of minutes, the anaphylaxis attack must be eradicated or slowed down or stopped as soon as possible. That's why epinephrine is so important.
Doctor, can I switch to you for a second?
Sure.
Now, what do you do?
So I'm an allergist, immunologist, and I see patients who suffer from allergies, from anaphylactic reactions, and so I treat food allergy, medication allergies, problems with the immune system, immunodeficiencies, venom allergies. And
what is an anaphylactic shock?
So anaphylactic reaction is a very severe allergic reaction. What happens with allergies is that the cells in the body, the immune cells, become agitated, for a layperson's terms, and they release chemicals that set off a very severe reaction. So the immune system becomes overactivated from foreign substance such as a food protein or insect venom or a medication. And what happens...
But in practical terms, what happens to the person? Like we heard Jon's sister went into a shock, basically?
So there are a number of things that can happen. The blood pressure goes very low. People can become very pale. They can have wheezing, such as when someone has asthma. They can have hives. They can have nausea, vomiting, diarrhea. And
do they collapse?
They can collapse. So what happens when the blood pressure goes too low is that someone can collapse. And so basically that the blood vessels open up too much and the blood sort of drains too much. And so you're not getting enough blood to the heart, to the lungs, and that's what happens. That's a form of shock. So anaphylactic shock is one of the forms of shock.
Jon spoke about epinephrine.
Right.
And
so,
I called it a wonder drug. What is it?
So epinephrine, actually, epinephrine is another name for adrenaline. We have adrenaline in our bodies, and this is an exogenous form or an outside form of adrenaline. And so what happens when we give someone epinephrine, which is in these devices, which I will demonstrate, is that it stops the reaction. It's safe, it's effective, and it stops what's going on.
Now, how is that? We discussed before Benadryl.
Right.
Now, how is this different than a Benadryl? I guess Benadryl must be a brand name, right?
So Benadryl is, right, so the
It's a substance.
other name for Benadryl is diphenhydramine. It's an antihistamine. So histamine is what's released from some of the cells when someone has an allergic reaction.
So it's dealing with the symptom, not the cause.
Exactly. And so the epinephrine stops the reaction in its tracks, whereas Benadryl or an antihistamine slows down the reaction, but
Now,
the epinephrine will stop it.
Now, John, one of the things that your organization has been doing has been lobbying here in Albany, and I first put in a piece of legislation having read about an incident in the New York Times about a kid who died because the school did not have epinephrine available. So I put in some legislation to authorize schools to have epinephrine without a specific prescription from a doctor for a particular kid. And now you've been lobbying here for all sorts of bills. You supported the bill that I put in, and since then we've worked together on some additional bills. What are you pushing for this year?
We're pushing most principally for generics. We have a bill, actually it's one that you created for us, that allows easier substitution of the generic brand for the brand names. And this gives patients more choice and also saves them money. So we're hoping that by having this legislation enacted, that this will help our patients and clients to more readily get the medication at a lower price.
And there's some other bills some of my colleagues have introduced for training of teachers,
yes,
training of other people, and
yes. The other one that's very important to our association is teacher training. Teacher training would allow newly hired teachers to have a very simple instruction program that they take to learn how to respond in an anaphylaxis emergency. It doesn't cost anything. It can be done online, less than an hour. And once these new teachers have had the training after 3 months on the job, it goes in their file, and that's the end of it. So by having more teachers trained, in case the school nurse is not available and an anaphylactic attack does happen, that they can render first aid and hopefully save someone's life.
yeah, it also gives people confidence that they know how to respond. Because, well, one of the things, Doctor, that I guess is part of this training is to be able to recognize the signs of anaphylaxia. Is that what you would call it?
Anaphylaxis.
Okay, anaphylaxis, as opposed to somebody choking on a chicken bone or something like that.
Right.
Right?
Right.
And so, but if someone is given epinephrine and they're in fact not having a seizure of anaphylaxis, because of proper words, what happens? Does it matter?
It's not a huge deal. So if someone has a milder reaction, they just have hives, or they don't know if their reaction is as severe as anaphylaxis, if they give themselves the EpiPen, the most that will happen is that they'll have increased heart rate, or they might feel a little bit of a lower blood pressure, or they might look pale.
So somebody
But
doesn't have to be
otherwise-
totally trained in this. They just have to recognize what might be anaphylaxis, and if they have an auto-injector, there's really very little downside to using it, but there's a real danger if they don't use it.
Exactly. We would like people, we always tell our parents and our patients, if you are in doubt and you're having an allergic reaction, use the epinephrine if you are not sure.
Now you have in front of you 3 trainers. These are.
I do.
Now one of them is let's try the first one. This one over here. Yes.
This one.
No, the other one first. That one. There is one brand that is that seems to have dominated the market.
Right.
And in its name has become synonymous with the auto-injector. It's kind of like
Exactly.
Scotch tape is the name that everybody uses for cellular tape, and go make a Xerox for me as opposed instead to a photocopy. So that's the imitation EpiPen.
This is EpiPen,
Right.
right. And so the way that this is used is it's very easy.
Modern technology here requires.
Yeah.
I'm sitting on the cord.
But you do have a few minutes to use the EpiPen. You don't have to.
You have a few minutes.
Right.
Blue to the sky, and you always inject it in the outside corner of the thigh. There's a click. 1, 1,000, 2, 1,000, 3, 1,000. Done.
And there's a large needle in there
There's a small needle.
To me, it looked like a large needle when I saw it, but okay.
There's a small
From a doctor's
needle,
point of view,
and
it's a small
it
one.
goes into the thigh. Okay.
Okay. Now, so that's the brand name EpiPen.
Right.
This is a generic.
This is a generic. It's an epinephrine auto-injector, and you just pull off the caps, and the idea is the same. You just inject it into the thigh.
And you hold it there for like 5 seconds, and that's it.
1,000, 2, 1,000, 3, 1,000, you're done.
Now the last one over there,
This last one is called an AviQ. The nice thing is that it's formulated a little bit different. And remember, the medications are all the same. It's all the same epinephrine. And so the nice thing about this is that it actually talks to you.
No needle or drug.
there you go. So
To inject, place black end against outer thigh, then press firmly and hold in place for 5 seconds. 5, 4, 3, 2, 1.
That's almost-
Injection complete.
that's almost a foolproof one. It tells you what to
It
do as
tells
you're going
you
step
what
by
to
step
do.
by step.
Trainer
Right.
may be reused
And so they're
for
pretty
training
easy
purposes.
to use. I think what happens is people get fearful, and there's really nothing to be fearful of. It's life-saving.
Now, when you talk to patients about this, what's their reaction?
People get nervous about using the epinephrine because they associate it with something bad. They think that it's a very dangerous medication, and it's a very safe medication, and it's very effective. We have them come into the office, and we have them use the trainers so that they become comfortable with us. And we tell families to tell everyone who's taking care of them or who's around them how to use the epinephrine and what symptoms to look for.
Now, we were talking before about the number of people in this country who have food allergies.
Right.
And you used the number like 8%?
8%. So the prevalence is about 8% in the United States.
So that's almost 1 out of 10 people. It's close to that.
It's close to that. About 2 patients in a classroom or 2 students in a classroom can have that, and that's just for foods. That doesn't account for venom allergy or medication allergy.
And we're talking about training. One of the things that I've heard, John, is in some situations, even the emergency medical technicians, the first responders, whether they be EMTs or not, don't think of using something like an EpiPen or intravenous epinephrine.
Yes, even professionals are sometimes reluctant to administer it because of the nature of the drug and also because of the type of injector that they use. They're afraid, in some instances, of maybe damaging the heart or things like this, by speeding it up or increasing their blood pressure. So they are reluctant. But as the doctor said,
yeah,
it's a very powerful drug, but without any side effects of a dangerous nature.
So this is all about education, and it's all about making these devices available to the public. I'm a little disappointed because I'm understanding that the health department has not yet put out regulations pursuant to one of the bills that we passed, which would make these devices widely available. Anybody who takes a course, a simple course basically, to learn what we just talked about and how to identify someone going into anaphylaxis, could get an EpiPen prescription. So we were hoping that we would see places like Madison Square Garden and other sports arenas and places, restaurants, have these available for their staff. So we're going to have to talk to the health department about that and see how far along they are in putting out those regulations. But I want to thank both of you for joining us. And to the people watching, I hope this was informative to you. Talk to your doctors about it. If you have any suspicion at all that you or anybody in your family have an allergy. And if we can help you in my office on anything else, we're in Tarrytown. Please don't hesitate to call 914-631-1605. 914-631-1605. Thank you.